Muhammad Ali carried his 7-year-old daughter Laila through the emergency room doors of Louisville General Hospital at 11:47 p.m. on a cold November night in 1975. Her small body was burning with fever, her face flushed and contorted with pain. She'd been complaining about stomach pain all evening, but in the last hour it had gotten worse, much worse. Sharp, stabbing pain in her lower right abdomen. Nausea, vomiting. All the signs Ali's wife Veronica had learned to recognize as potentially serious. "Please," Ali said to the nurse at the reception desk, his voice tight with fear that had nothing to do with any opponent he'd ever faced in a ring. "My daughter, she's in a lot of pain. I think it might be her appendix." The nurse looked up, recognition flashing across her face. Muhammad Ali, the heavyweight champion of the world, standing in her emergency room at midnight, holding his sick child. "Let me get the doctor," she said, reaching for the phone. "Have a seat, Mr. Ali." "Wheel." "I'm not sitting," Ali said firmly but not unkindly. "Every minute counts with appendicitis. If it ruptures," he didn't finish the sentence. "Didn't need to." Before we continue with the story, you can support us by subscribing to the channel and liking the video. Don't forget to write in the comments where you're watching from and how old you are. Let's continue. The nurse nodded quickly and picked up the phone. Within 2 minutes, a doctor emerged from the treatment area. Dr. Richard Hayes was 52 years old, had been practicing medicine for 26 years, and had the kind of reputation that made people either respect him deeply or avoid him entirely. He was brilliant, everyone acknowledged that. But he was also known for being difficult, stubborn, set in his ways. And he was a man who'd grown up in a Louisville that believed in segregation, even if the law no longer allowed it to be written down. Hayes looked at Muhammad Ali, then at the child in his arms, then back at Ali. His expression didn't change, but something flickered in his eyes, something that made the nurse who'd called him suddenly uncomfortable. "What seems to be the problem?" Hayes asked, his voice clinical, detached. "My daughter has severe abdominal pain, right lower quadrant. High fever. Nausea. I think it's appendicitis. She needs to be examined immediately." Hayes glanced at his watch. "Mr. Ali, this is a very busy night. We've got multiple trauma cases, a cardiac arrest, several other emergencies that require immediate attention. I'm afraid we're at capacity right now." "Then find capacity," Ali said, and there was steel in his voice now. "My daughter is in pain. She needs help. That's what emergency rooms are for." "I understand your concern," Hayes said, and his tone was the kind of professionally polite that carried no actual empathy. "But I'm going to have to suggest you take your daughter to County General. They have more resources available tonight." The nurse's eyes went wide. County General was 40 minutes away. Everyone in Louisville knew that County General was where the city sent patients they didn't want to treat at the better-funded hospitals. It was understaffed, overcrowded, and if you had a genuine emergency, 40 minutes might be the difference between life and death. Muhammad Ali stood perfectly still, his daughter whimpering in his arms, and looked at Dr. Richard Hayes with an expression that made the emergency room suddenly feel smaller. "Did you just tell me to take my sick child to another hospital?" Ali's voice was quiet, dangerously quiet. "My daughter who might have appendicitis, a life-threatening condition that requires immediate surgery if the appendix ruptures. You're telling me to drive 40 minutes to another hospital?" "I'm telling you that we don't have the resources to treat her tonight," Hayes said. "It's a simple matter of medical logistics." But it wasn't simple, and it wasn't about logistics. Everyone standing in that emergency room knew exactly what this was about. The nurse knew it. Ali knew it. And somewhere deep down, Dr. Richard Hayes knew it too. This was about a black man, even if he was the heavyweight champion of the world, standing in a Louisville hospital with his sick daughter, being told to go somewhere else. This was about old prejudices wearing the mask of professional language. This was about the color of skin mattering more than the pain of a child. Muhammad Ali had faced racism his entire life. He'd been denied service at restaurants. He'd been refused rooms at hotels. He'd fought against discrimination and injustice for years. But this was different. This wasn't about him. This was about his 7-year-old daughter, crying in his arms, her appendix possibly about to rupture while a doctor who'd taken an oath to do no harm stood there and told him to go somewhere else. What happened next would make national headlines. It would destroy one doctor's career and force a hospital to confront uncomfortable truths about who they treated and who they turned away. But most importantly, it would show that Muhammad Ali's most important fights weren't the ones that won him championships. They were the ones that protected the people he loved. Dr. Richard Hayes had taken the Hippocratic Oath in 1949, promising to first do no harm. He delivered that oath in a medical school that had no black students, in a city where hospitals were still segregated by law. And though the laws had changed, though segregation was officially illegal, Hayes had never really adjusted his thinking. In his mind, there were still lines that shouldn't be crossed, standards that should be maintained, a natural order that modern politicians had disrupted with their civil rights legislation. He looked at Muhammad Ali now and saw someone who'd refused the draft, who'd aligned himself with the Nation of Islam, who'd become a symbol of black resistance and pride. Hayes didn't like what Ali represented, didn't like the way he talked back to white authority, didn't like the way he carried himself with the kind of confidence that white Louisville had spent generations trying to suppress in black men. And so, standing in the emergency room of Louisville General Hospital, Dr. Richard Hayes made a choice. Not a medical choice, a personal one. He decided that Muhammad Ali's daughter could wait, could go somewhere else, could become someone else's problem. Mr. Ali, Hayes said, his voice taking on that condescending tone that doctors sometimes use when they think patients don't understand medicine, I assure you that if this were a genuine emergency, we would treat your daughter immediately. But based on what you've described, this can wait until you reach County General. Based on what I've described, Ali's voice rose slightly. I've described classic appendicitis symptoms. You haven't even examined her. You haven't taken her temperature. You haven't palpated her abdomen. You're making a diagnosis without even looking at my daughter. I'm making a triage decision based on what? On the color of her skin? The words hung in the air like a challenge. Because that's what this is about, isn't it? If I was a white man standing here with a sick child, would you be telling me to drive 40 minutes to County General? The nurse gasped. Several other staff members who'd been pretending not to listen suddenly stopped what they were doing. Other patients in the waiting area, maybe a dozen people, all turned to watch. Hayes's face flushed red. Mr. Ali, I resent that implication. I am a physician. I make medical decisions based on medical need, not. Then examine her. Ali stepped forward, still holding Laila, who was now crying softly. Look at my daughter. Take her temperature. Touch her abdomen where it hurts. Do the basic medical assessment that any doctor would do before sending a child with possible appendicitis on a 40-minute drive to another hospital. If you examine her and determine she's stable enough for transport, fine. But at least do your job. Hayes's jaw tightened. He was trapped now. If he refused to examine the child, he'd be proving Ali's point. But examining her meant admitting he should have done it in the first place, which meant acknowledging he'd let his personal feelings override his medical judgment. Fine, Hayes said curtly. Bring her to examination room 3. Ali followed Hayes down a short corridor to a small examination room. A young nurse, different from the one at reception, came in to assist. Hayes took Layla's temperature without saying a word. 102.4 degrees. High, but not dangerously so. He asked her to lie down on the examination table. Show me where it hurts, Hayes said. Laila pointed to her lower right abdomen. Hayes pressed gently on the area. Laila screamed, a sharp, piercing cry of pain that made Ali's hands clench into fists. Does it hurt more when I press down or when I let go? Hayes asked, his tone still clinical, detached. When you let go, Laila whimpered. Rebound tenderness. A classic sign of appendicitis. Hayes knew it. The nurse knew it. And Ali, who'd done his research before driving to the hospital, knew it too. Hayes stepped back from the examination table. It could be appendicitis, he said, but it could also be any number of other conditions. Gastroenteritis, constipation, without further testing. So order the tests, Ali said. Blood work, imaging, whatever you need to do to figure out if my daughter needs emergency surgery. Mr. Ali, as I've already explained, we're at capacity tonight. The wait for imaging could be several hours. County General has. Stop. Ollie's voice was sharp enough to cut glass. Just stop. My daughter is lying on that table in pain. You've just confirmed she has symptoms consistent with appendicitis. And you're still, even now, trying to send her somewhere else. So let me ask you directly, Dr. Hayes. Is this hospital at capacity? Are you genuinely unable to help my daughter? Or do you just not want to? The young nurse looked at Hayes with an expression that clearly said she wanted to know the answer to. Because the truth was, Louisville General was busy. It was a Saturday night, and emergency rooms were always busy on Saturday nights, but it wasn't overwhelmed. There were 2 empty examination rooms. The imaging department was staffed. The surgical team was on call. Hayes could help Laila Ali. He just didn't want to. My medical opinion, Hayes said stiffly, is that your daughter would be better served at County General. Muhammad Ali looked at this man, this doctor who'd taken an oath to help the sick and injured, who'd spent 26 years in medicine, who had the knowledge and the resources to potentially save Laila's life, and made a decision of his own. Okay, Ali said quietly, if that's how you want to play this. He picked up Laila gently from the examination table. I'm sorry, baby, he whispered to her. Daddy's going to take care of this. Then he walked out of the examination room, down the corridor, and back into the waiting area. But he didn't head for the exit. Instead, he walked to the center of the waiting room, still holding Laila, and in a voice that carried to every corner of the room, he said, My name is Muhammad Ali. My 7-year-old daughter has appendicitis, and Dr. Richard Hayes just refused to treat her because she's black. The waiting room of Louisville General Hospital went completely silent. 12 patients, 7 family members, 3 nurses, 2 security guards. Everyone stopped and stared. Dr. Hayes examined my daughter. Ali continued, his voice strong and clear. He confirmed she has symptoms of appendicitis, a potentially life-threatening condition that requires immediate treatment. And he told me to drive her 40 minutes to County General. Not because this hospital doesn't have the resources to help her, but because he doesn't want to treat a black child. One of the security guards moved forward. Sir, I'm going to have to ask you to. To what? To leave while my daughter might be dying? To accept that in 1975, in America, a doctor can refuse to treat a sick child because of her skin color. Ali shook his head. No, I'm not leaving. I'm staying right here until my daughter gets the medical care she needs. A woman in the waiting room, white, middle-aged, holding a bandaged hand, stood up. Is that true? Did the doctor really refuse to treat your daughter? Ask him yourself, Ali said. He's right down that corridor. The woman walked toward the corridor, then turned back to the rest of the waiting room. Anyone with a medical emergency deserves treatment. I don't care who they are. This is wrong. Another patient stood up, then another. Within minutes, half the waiting room was standing, and the security guard were looking increasingly uncomfortable. One of them reached for his radio. You better call the police, Ali said to the guard, because I'm not leaving until someone treats my daughter. You can arrest me. You could drag me out of here. But you better believe that every camera in this city will be here to film it. Muhammad Ali, heavyweight champion of the world, arrested for trying to get medical care for his sick child. That's going to make one hell of a headline. The guard hesitated, his hand still on his radio. The other guard was looking toward the administrative offices, clearly hoping someone with more authority would handle this situation. That's when Dr. Richard Hayes emerged from the corridor, his face red with anger. Mr. Ali, you are disrupting this emergency room. You are preventing us from treating other patients. If you don't leave immediately, I will have you removed. Then remove me, Ali said calmly. Call the police. Have me arrested. But understand something, Dr. Hayes. When this story hits the papers tomorrow, when people learn that you refuse to treat a sick child, your career is over. Every decision you make tonight will be examined. Every patient you've turned away will come forward. And everyone will know that you put your prejudice above a child's life. Hayes took a step forward, his finger pointing at Ali. You don't know what you're talking about. I made a medical decision based on what? You examined her for less than 3 minutes. You confirmed she has appendicitis symptoms. You have the resources to help her. But you chose not to. That's not medicine, Dr. Hayes. That's racism. The waiting room erupted. Patients started shouting questions at Hayes. Is that true? Did you refuse to treat his daughter? What kind of doctor are you? Hayes looked around, suddenly realizing he'd lost control of the situation. Everyone calm down. This is a medical facility, not what? Ollie interrupted. Not a place where people expect doctors to actually help them. Not a place where a sick child should be able to get treatment regardless of a race. A television crew arrived. Someone in the waiting room had called the local news station, and now there was a camera pointing at Muhammad Ali holding his crying daughter. A reporter pushed through the crowd. Mr. Ali, can you tell us what's happening here? Ali told the story again, calmly and clearly. The symptoms, the examination, Hayes's refusal to admit Laila for further testing, the suggestion to drive 40 minutes to County General. The reporter turned to Hayes. Dr. Hayes, is what Mr. Ali saying true? Did you refuse to treat his daughter? Hayes's face had gone from red to pale. I made a medical judgment that. Did you refuse to admit a child with appendicitis symptoms? The reporter pressed. The hospital is at capacity. Is it at capacity right now? Are there no available beds? No imaging equipment? No surgical team? Hayes's silence was answer enough. The hospital administrator arrived 10 minutes later, a thin, nervous man named Douglas Patterson who looked like he wanted to be anywhere but here. He took one look at the television camera, at Muhammad Ali, still holding his daughter, at the crowd of angry patients, and understood immediately that this was a crisis. Mr. Ali, Patterson said, his voice professionally calm despite the sweat on his forehead. I understand there's been a misunderstanding. Let me assure you that Louisville General Hospital treats all patients regardless of. Then why is my daughter still not being treated? Ali interrupted. It's been 30 minutes since we arrived. 30 minutes since Dr. Hayes examined her and confirmed she has appendicitis symptoms. And she's still in my arms instead of in a hospital bed. Patterson turned to Hayes. Richard, what's going on here? I made a triage decision based on. Is the hospital at capacity? Patterson asked bluntly. Hayes hesitated. We have multiple emergencies. That's not what I asked. Do we have beds available? Is imaging operational? Is the surgical team on call? Another pause. Longer this time. Everyone watching knew what that pause meant. Answer me. Richard, Patterson said, and now his voice had an edge. Can this hospital treat this child or not? Yes, Hayes said quietly. We can treat her. Then why haven't we? Patterson's face was flushed now. Why is Muhammad Ali's daughter, a child with suspected appendicitis, still in the waiting room 30 minutes after arriving? Hayes didn't answer. Couldn't answer. Because any answer would be an admission of what everyone already knew. Patterson turned to Ali. Mr. Ali, I apologize on behalf of Louisville General Hospital. Your daughter will be admitted immediately. We'll run blood work and imaging within the hour. If surgery is needed, our surgical team will operate tonight. I give you my word that she will receive the best care we can provide. Thank you, Ali said. Then he looked at Hayes. But I want him off her case. I want a different doctor. Someone who sees her as a patient who needs help, not a black child who should go somewhere else. Patterson nodded. Of course. Dr. Sarah Mitchell is our best pediatric surgeon. She'll take over Laila's care immediately. He turned to Hayes. Richard, I need to see you in my office. Now. As they walked away, Ali heard Patterson's voice, low but angry. Do you have any idea what you've done? Do you understand the lawsuit we're facing? The publicity nightmare? You better hope that child doesn't have appendicitis, because if she does, if she'd had a ruptured appendix because you delayed treatment, your career is over. Hayes's response was too quiet to hear. But his body language, shoulders slumped, head down, said everything. Within minutes, Dr. Sarah Mitchell appeared, a woman in her 40s with kind eyes and a no-nonsense manner. She examined Laila quickly and thoroughly, ordered immediate blood work and a CT scan, and had Laila admitted to a pediatric room within 30 minutes. The CT scan showed acute appendicitis. Laila went into surgery at 2:15 a.m. The surgery was successful, and by morning she was in recovery, her appendix removed before it could rupture. Muhammad Ali sat beside her bed, holding her hand and thought about how close they'd come to disaster. If he'd listened to Hayes, if he'd driven to County General, if Layla's appendix had ruptured during that drive. He didn't finish the thought. She was safe. That's what mattered. But Dr. Richard Hayes' career was far from safe. The story made national news. Doctor refuses to treat Muhammad Ali's daughter. Ran in papers across the country. The footage from the emergency room, Ali holding Laila, confronting Hayes, refusing to leave, played on every network. Louisville General Hospital launched an immediate investigation. What they found was damning. Hayes had a pattern of behavior, not always as obvious as the Ali incident, but a pattern nonetheless. Black patients with longer wait times. Black patients more likely to be referred to County General. Black patients who left the emergency room without being seen. The Kentucky Medical Board opened their own investigation. Hayes was suspended pending review. His lawyer argued that he'd made a reasonable medical judgment, that the hospital had been busy, that Ali was being unreasonable. But the evidence didn't support that defense. The hospital records showed empty beds. The nursing staff testified that Hayes had explicitly said he didn't want to deal with Ali and his demands. The young nurse who'd assisted with the examination came forward and said Hayes had told her, "Let them go to county. See how they like being treated like everyone else." 6 months later, Dr. Richard Hayes surrendered his medical license. He claimed it was voluntary, that he wanted to retire anyway. But everyone knew the truth. He'd been given a choice: surrender the license or have it revoked after a public hearing that would expose decades of discriminatory behavior. Hayes never practiced medicine again. He spent his remaining years in bitter isolation, convinced that he'd been persecuted for making a reasonable decision, never acknowledging, perhaps never understanding, that his reasonable decision had almost cost a child her life. Louisville General Hospital implemented sweeping changes. New policies on patient treatment, mandatory anti-discrimination training for all staff, a patient advocate program to ensure no one was turned away because of race. But more importantly, Laila's story became a catalyst for examining how racial bias affects healthcare. Studies started looking at treatment disparities. Medical schools added cultural competency training. Hospitals across the country reviewed their own practices. Years later, Dr. Sarah Mitchell, the surgeon who'd operated on Laila, spoke at a medical conference about the incident. What happened that night wasn't an anomaly, she said. It was a symptom of a larger problem. Dr. Hayes was blatant about his racism, which made him easy to condemn. But how many other doctors make similar decisions in subtler ways? How many black patients wait longer for pain medication? How many are taken less seriously when they describe symptoms? How many are referred elsewhere when they should be treated immediately? Muhammad Ali's fame meant his daughter's story got attention. But how many children without famous fathers have been turned away? How many have suffered because of unconscious bias or explicit discrimination? Muhammad Ali himself rarely spoke about that night. When reporters asked, he'd say, "My daughter got the care she needed." That's what matters. But every child, every person deserves the same. Your health care shouldn't depend on who your father is or what color your skin is. Laila Ali grew up to become a professional boxer herself, undefeated in 24 fights. In interviews, she'd sometimes mention that night in the hospital. "I was 7 years old and in pain," she'd say. "I didn't understand everything that was happening, but I understood that my father was fighting for me. Not with his fists, with his voice, with his refusal to accept that I didn't deserve help. That's the most important thing he ever taught me. You don't accept injustice. You stand up. You fight back." The nurse who'd first called Dr. Hayes that night, the one who'd gasped when Hayes suggested County General, left Louisville General 6 months after the incident. She became a patient advocate, working specifically with minority communities to help them navigate healthcare systems. "I saw what almost happened that night," she said. "I saw how close we came to failing a child because of racism. I never want to see that again." Muhammad Ali fought many battles in his life. He fought Sonny Liston and George Foreman. He fought the U.S. government over Vietnam. He fought racism and injustice wherever he found it. But the night he fought for Laila in that Louisville emergency room might have been his most important fight, because it showed that even in 1975, even after civil rights legislation, Even in a medical facility where helping people was supposed to be the highest priority, racism could still be deadly. Dr. Richard Hayes made a choice that night based on his prejudices. Muhammad Ali made a choice based on his principles. And the difference between those two choices was the difference between a doctor who lost his career and a father who saved his daughter's life. The real lesson of that night wasn't about Muhammad Ali's fame or power. It was about what happens when someone refuses to accept injustice. When someone stands in an emergency room and says, "No, this is wrong, and I'm not leaving until it's made right." That's what champions do. They fight, not just for titles or glory, but for what matters, for the people they love, for basic human dignity, for the idea that every child deserves medical care regardless of the color of their skin. Muhammad Ali was the greatest boxer who ever lived. But that night in Louisville General Hospital, he proved he was something more important. He was a father who loved his daughter enough to risk arrest, to create a scene, to refuse to be quiet and polite when quiet and polite meant accepting discrimination. And somewhere in hospitals and clinics across America, doctors and nurses remember that night. Remember that healthcare is a right, not a privilege. Remember that every patient deserves to be treated with dignity and care. Remember that the color of someone's skin should never determine whether they receive help. That's Muhammad Ali's legacy. Not just the fights he won, but the stands he took, the injustices he refused to accept, the example he set for anyone who's ever faced discrimination and wondered whether one person could make a difference. One person can. One father did, and his daughter lived to tell the story.